So I'm Ailish Wilkie from Atrius Health in Boston. I have worked in that organization for 6 years. However, I've been using the RL software for nearly 10 years in different positions. I can honestly say that when I came to Atrius back in late 2008, they didn't have RL Solution software, and I was coming from 2 organizations that did. They were in the negotiation process of bringing on board an event reporting software, and I made it clear that I wasn't going to move to Atrius unless they went with RL Solutions. So one of my favorite features is the info center for frontline staff. So often we hear from people, I want to know what happened as a result of the event that I reported. I want to know somebody's looking at it. Now with the ability for frontline staff to have an info center and be able to see where the event is in the review process, it makes them feel more connected to what they're doing and seeing that it isn't going into a black hole, that somebody is updating the event and someone is working on it continuously. I think that's really helpful for our frontline staff. We have rates of reporting that are pretty similar to some of the larger teaching hospitals in the Boston area. So we're pretty proud at the amount of reports that we're seeing, and I do think that a lot of that comes from the ease of use of the reporting system. Back in 2009, when we first implemented the system, we saw a 400% increase in the number of events that we were seeing prior to having the RL Solution software. So we did see a tremendous increase in our reporting rates, and we're continuing to see them increase after implementing RL6. We're starting to see a bigger grouping of different roles of reporters. So just last month, we had 23% of our reports came from physicians within the organization, which is pretty high. We are a physician-led organization, so it's not unheard of, but we are seeing physicians and nurses doing a big chunk of our reporting now, which is great.